Hi, my name is Jessie. I'll be your patient care tech today. If you can just confirm your name and date of birth for me. Okay, perfect. If it's okay with you, we'll just be obtaining a clean catch urine specimen. Alrighty, perfect. Let me just label your cup. Perfect. So I'm going to give you this cup, which you're going to pee in, and I'm going to give you 3 tablets. And I'm going to just give you some instructions. So once you get into the restroom, you are going to set these off to the side. We're just going to wash your hands very well. Just make sure they're thoroughly clean, so everything stays clean during this procedure. We're going to grab our 3 towelette packages, and we're going to open them and have them readily available during the procedure. Alright, and firstly, then you're going to grab your cup and then screw the lid. And again, just whenever during the procedure, we never ever want to touch inside the cup. We just want to ensure everything stays clean during the procedure and the procedure remains sterile so your results come back correctly. And firstly, if you're a female, you're going to squat over the toilet. You're going to grab one of your hands and you are going to spread apart the folds around on your vagina to expose your urinary opening. Then you are going to further, with one hand again, spread apart your labia, exposing your urinary meatus. This is where your pee comes out of. You're going to grab one of your wipes and you're going to wipe front to back on one side of urinary meatus and dispose. Grab the other wipe and do the other side, front to back, urinary meatus, and dispose. Third wipe, you're going to grab it and wipe directly on your urinary meatus. This is where your pee comes out of, and dispose. And then, by still holding apart and exposing your urinary meatus with one hand, you're going to grab your cup. You're going to void a little bit into the toilet. You're going to put the cup under to catch the pee. You're going to catch the pee until it's about halfway full, right here. And then you're going to move the cup away, and you're going to keep voiding into the toilet until you're done peeing. Then you're going to wipe as usual. You're going to screw the lid back on and just make sure we never ever touch inside the cup. And then we are going to wash your hands as usual. Just make sure you wash your hands very well. And there should be a designated area in the room to put this cup. And then if you are a male, you're going to expose your penis. And then you are going to retract your foreskin. And once your foreskin is retracted, this is only if you're uncircumcised. If you're circumcised, you can skip that step. You're going to grab one of your ready wipes and you're going to wipe on one side of your glans penis, dispose. You're going to grab your other wipe on the other side of your glans penis and dispose. And then grab your third wipe and wipe directly on your urethral opening. And this is just where your pee comes out of, and then you're going to dispose. And then you're going to grab your cup. You're going to void a little bit into the toilet. This just means pee a little bit into your toilet. And then you're going to move the cup under to catch the urine. Again, we never ever want to touch inside the cup, your penis, your fingers, or anything. We just want to make sure this procedure remains sterile. You're going to pee halfway in the cup, and then you are going to move it away. Finish peeing or voiding into the toilet. Then you're going to wipe as usual, and you're going to screw the lid back onto the cup and place it in the designated area there is. And just make sure we wash our hands after very thoroughly, just to make sure everything remains clean. Alright, perfect. And then they do the procedure. And then I have to document that I have obtained the urinary specimen, hand hygiene, and done.